Hello, everyone. Happy Friday. Welcome to our webinar where we will discuss health conditions for the fall semester for our Global Scholars and London Scholars program. We'll give folks a few minutes to make their way in. So I will start in just a minute. All right, I still see some folks trickling in. No worries. Feel free to get settled. I'm excited to spend this hour with you. All right. For the interest of time, I'll go ahead and get started. My name is Dr. Shannon Fairley Pittman. I'm the director of our Global Network Pathway programs, and so excited for you all to begin your journey, whether that's your student or a family member here today for this webinar. We're so excited to welcome you all to Northeastern, but also our program this upcoming year for, again, the Global Scholars and London Scholars program. Today, we are gathered so that we can talk about the health considerations as you are preparing to begin your journeys for either starting in Oakland, London, or Boston. And I have colleagues here who are going to talk with you about the different ways of engagement regarding these health considerations. One member, colleague Alyssa Berg from our Global Safety Office, and then Mary Barrows from our Disability Resource Center that works with all of our 3 campuses. Before then, I just want to give a quick housekeeping. We do have a Q&A box. So if you look at the bottom of your screen, you can see a Q&A box. That exactly, you can go ahead and begin to ask us questions. We would like for you to take a moment just to kind of go through the presentation because we do have lots of information that we will share with you. You can take screenshots of the presentation, but if you have questions, of course, you can ask us in the Q&A box, and then some members of our team will be able to ask you questions or answer your questions. If there's specific themes that are coming up, we might not answer your question, but we might bring it up broadly into the large group towards the end of the presentation. And then we will be recording this presentation. So feel free to just sit back and relax again and take in the information. And we'll be sending out an email next week to all students of the Global Scholars and London Scholars program and any parent who is listed as their guardian in our records. So folks will receive that message next week. One more housekeeping note, sorry, is that we actually will be talking about many of these things as well during our pre-departure orientation that some of you might have already registered for. That's happening on July 12th and July 14th in Boston. So you actually get to meet some of us and see us in person. We'll be talking even more about these things during that time. Your students have already been invited to what we call our online module for Articulate Rise. So they can see our modules around orientation sessions via their app status check. So they should be able to complete that by July 31st. And then we will have one final session that we're calling our August webinar, getting folks excited for starting their journey in the program. And you'll hear more about that soon. If you have not already received communication, we'll be inviting you to something like this, a Zoom webinar in August. So without further ado, I'll go ahead and turn it over to my colleague, Alyssa.
Hi, everyone, and thank you, Shannon, for that introduction. So as I mentioned, or as Shannon mentioned, my name's Alyssa Fontana Burke. I'm with the Global Safety Office here at Northeastern. I'm going to be walking you through the presentation today with Mary, my colleague from the Disability Resource Center. I'm going to be talking a bit about pre-travel considerations. So part of the reason we wanted to do this today prior to your orientations in a few weeks in August is to to give you that time to really prepare for this experience and get everything in order prior to travel, wherever that may be. And then I'll talk a bit about seeking care while on site. And then I'll hand it over to Mary to discuss accommodations through the Disability Resource Center. And then hopefully we'll have some time for questions at the end. Just for some expectation setting, please ask the questions as Shannon mentioned through the Q&A. Mary and I will address some questions at the end. Shannon may also be able to address some of the questions as we go through the presentation. But again, if there's any general themes, we may address them as a group towards the end of the presentation as time allows. I will not be giving you specific medical advice today. These are going to be general tips, considerations, and information that you should take back to your healthcare professional to discuss. I just am providing you with the tools to help better equip you for that conversation. And then please note that each destination between the three is unique. The resources, the norms around medical care, and the regulations vary by each location. I'll talk a bit about each site and what's available to you, but please know that they are, there are some differences there that you should be aware of. So a bit more about my office before I begin. I'm from the Global Safety Office. We are technically part of the police department, though we are not police officers, and our role here is to support all Northeastern university programs that travel, essentially moving across the global networks and abroad. So we do a lot of pre-travel planning and training such as this, as well as we assist if there are any crises abroad. And so someone from our office is always on call. We have a website, globalsafety.northeastern.edu. I recommend that you check that out. It has a lot of different resources that are available to you, as well as some requirements and expectations of Northeastern travelers. The easiest way to get in touch with my office is my travel plans at northeastern.edu. But to familiarize yourself with the rest of my office, my director is Kushal Safi and my colleague is JJ Kappa. We will follow you through your Northeastern career. So once you have completed the Global Scholars, London Scholars, whatever program you're on, if you decide to go on a Dialogue of Civilizations or you study abroad later on down the line in your Northeastern career, or you go on a global co-op, for example, we are here to support you through that whole time while you're a student here at Northeastern. So it's very nice to meet you all today, and I look forward to getting to know you throughout the next 4 or 5 years or however long you're with us. We do maintain a 24/7 international assistance hotline, and I'll talk a bit more about that later in the presentation. So some information here and a bit of a checklist for you that you can take back to your doctor or to your family to discuss prior to the beginning of your program and to your travel to your first location. So between now and when your program starts, I recommend that you consult with your healthcare provider. If you haven't had a physical or a checkup in a while, now this summer would be the time to do that. We do not require that you submit documentation of a physical here at Northeastern, but it's always good to check in with your doctor prior to you being away for an extended period of time. So take care of those routine appointments before you go, just in case maybe you've got a cavity developing or something going on that you want to get taken care of now so that it doesn't become a greater problem while you're away or abroad. I would recommend that you discuss with your doctor where you'll be going, how long you'll be staying, and then specifically any medication or care needs, because you really want to be able to continue your care while you are at your destination, and you want to make sure you have a plan in place for what that may be. And we'll talk more about obtaining resources and finding out what those resources are in a bit, but it's always good to have that conversation in advance. You also will need to confirm your insurance coverage for your time in Oakland, Boston, or London. So depending on the circumstances, you are still required to have primary medical insurance that covers you no matter where you are going. So whether that be Oakland, Boston, or London. And so if you are traveling to London, you should especially check with your insurance provider to see about coverage abroad. Oftentimes it's on a reimbursement basis. And if you are also enrolled in a state exchange-based insurance product, if you are going out of state to a new state for your program, so whether it be Oakland or Boston, you should check with that provider to see that it covers you in those states, because there can be limited coverage depending on the plan that you have. So you want to make sure that you are covered in the locations that you're traveling to for the fall. For Northeastern travelers abroad, Northeastern provides urgent and emergency care coverage, but that does not cover routine care or prescription refills. So you would be expected to pay out of pocket for those and then file back through your primary health insurance for those needs. And then for any location, Northeastern does not provide travel insurance. So this does not cover your belongings, your flights, and then additionally that routine care. So if that's something you're interested in, travel insurance, renter's insurance, those type of things you should be considering in advance of your program start. So once you speak with your doctor about what your care needs may be abroad, it's really important that you have that plan for your time, whether it be abroad or in Oakland or Boston. I'm going to go through each different site and talk about some specific resources that are available to you on each site. But I want to specifically talk a bit about those going to London and their medication needs, because the medication availability may be different in the UK than it is for your medication here in the US, and it may be difficult for you to obtain abroad. So you want to have those conversations with your doctor about that. Oftentimes they can look to see what might be available in the UK to see if the medication you take is currently available or not. But you may have to discuss alternatives or other options if your medication is not available locally in the UK and you are not able to bring a full supply. If you are bringing medications with you to London, I do recommend that you visit the link in the red here. So this talks about traveling with medication specifically to the UK. And if you are taking a supply of medication that contains controlled substances, you may need to apply for permission with the regulatory body that's listed on this website in order to bring that amount, that supply into the country. So it's a very clear website. It's got different medication types and names on there to help you determine if your medication is considered a controlled substance or not. So I definitely recommend, if you are traveling with medications to London, that you check out this resource. It is a great resource to help guide you on some tips and information for traveling with your medication. If you're not able to bring a full supply to London, there are options available to you to find a doctor locally that may be able to prescribe you a local prescription for your medication, or to help work with you on what alternatives may be available. But this is really important to have notes from your doctor, past records. So if you are seeing a doctor locally, they may already be able to know what medications you've tried in the past, what hasn't worked for you, what your local home doctor recommends, so that they can then kind of work with what they have available to them. We have a number of providers that we work with locally that can help with prescribing medications, and particularly as it relates to mental health or to ADHD or other types of those medications that you may need to see a psychiatrist for. We have resources identified locally in London, but we definitely recommend that you do not wait until you're there or till you're almost running out of medication to set up those appointments. If you are someone that needs to set those appointments up in advance, reach out to us at mytravelplans@northeastern.edu, and we can send information to you about what those resources may be. As I mentioned, our insurance, our urgent and emergency coverage for students abroad does not cover medication refills or ongoing routine care. So those things you would have to pay out of pocket for and then file back to your primary medical insurance. So that's why it's important to have that and to know what the coverage is overseas for those type of items. We also do have a relationship locally with a counselor. So if you are looking to continue like talk therapy in London as well, you can reach out for that. Consider all of the factors that go into your well-being at home and how you're going to apply that at your time in Oakland, London, Boston, wherever you may be going. So in addition to therapy or medication, this could also include exercise, your diet, like specifics about your routine. There's going to be a lot of change just associated with going to college, going away from your family, possibly for the first time, potentially moving to another country, another city. And so you want to think about what you can kind of control in that environment and what makes you happy and healthy and how you can carry that over into your time wherever you're going. So whether that's factoring in exercise into your routine or thinking about, what you want to eat or what you want to bring with you in terms of, exercise, if you want to bring a yoga mat or something along those lines, plan ahead so you have those tools in place to be able to support you in that transition and then throughout your time. And then packing accordingly, especially as it relates to medications, anytime you're traveling, especially if you'll be getting on a plane to go wherever you're going, make sure that you're packing your medication in its original packaging, clearly labeled with prescription information, and carrying it in your carry-on is really important because your luggage can get lost, delayed, it can get tampered with. So having it on on your person is really important. We do also recommend that you carry a copy of your prescriptions as well as a letter from your healthcare provider. This is really helpful for any provider that you will see locally in your destination. If you do need refills of medication, if you do need any follow-up care, it's really important to have that documentation available so that the physicians can have a record available to them. If you are someone that has chronic illness like Crohn's disease or has dietary restrictions or allergies, we have put together a Google Doc here that has a number of resources for traveling with allergies, traveling with chronic illnesses, some different tips and tricks for you to plug the co-op program. I'm sure it has been a draw for a lot of you to come to Northeastern. My office has a co-op each semester, and a co-op student has actually put this together. They were a student that had chronic illness and like to travel, and so they put this together to help other students be able to do so. So if you're interested in the work that I do, just a plug for the future when you're looking at co-op opportunities. If you have allergies, for those of you going to London, well, London is an English-speaking country. If you will be doing any traveling throughout Europe where English is not the first language, you may want to have your allergens either, have pictures on them or have them written down in the local language or wherever you'll be traveling to, so that you can show them if need be at a restaurant, or if you've got medication allergies, having those written down in case of emergency is really important that you can share that information quickly. So you can use that QR code if that is of interest to you. So now seeking care while you're on site. So you've talked to your doctor, you're prepared for travel, you get to your destination, whether it be London, Oakland, Boston. You're going to have a site-specific orientation, which is going to go into a lot more detail about the different resources and support networks that are available to you on site. But I'm going to give you a very high level overview of what is available so you are aware kind of going into it what to expect. Your on-site staff are a great resource for guidance. So whether it's your RAs or your coordinators in Oakland or your residence life staff in London, there is always someone that you can talk to. There's always going to be someone on call if you need assistance. There's also local emergency numbers that you should be aware of in case you need emergency services. So in the US, it's 911. In the UK, it's 999. If you're in Boston, there's NUPD, our police department that you can call. If you're in Oakland, there's also public safety. We'll talk a bit more about my 24/7 hotline, which is the Global Safety and Support Network in a minute. But just a note that in order to be able to call some of these resources, you need to have calling capabilities, particularly if you are traveling to London, you need to maintain calling capabilities while you are abroad. This can be through your current phone plan, if they have a global plan, or through a local SIM that you obtain on arrival. But it's really important that you have that ability to call out for help if you need it, or receive calls if we're trying to get in contact with you. So some general high-level overview of the resources that are available to you in Boston. As I mentioned, the local emergency is 911, and UPD is available 24/7 at this phone number, 617-373-3333, or they also have 617-373-2121, which is non-emergency line. There is a university health and counseling service that is available on campus. So to check out a bit more about what they do and what resources are available to you, their website is northeastern.edu/UHCS, and they can be reached at the contact information below. And all students in Massachusetts are required, or all individuals really in Massachusetts are required to have personal health insurance that covers them for their time abroad here, or time here. Apologies. Resources in Oakland. So similarly, local emergencies 911, public safety office is 1-510-430-5555. There is a student health and wellness. So there's a health clinic as well as a counseling service on campus. Similarly to UHCS and the health center in Oakland, neither are like emergency services. So in the event that you need an ER, an urgent care situation, you will be sent to local hospitals for care. And so while seeking care through the health clinic at Oakland is free for students, if you are referred outside of that, you will need to have personal health insurance that will cover you locally within the hospital networks and things of that nature, or if you need a specialist. So more information, and we can send you the link to this health and wellness page as well for you to be able to explore the resources available to you. Now, resources in London are a bit different than the other two US campuses. For medical care, primarily the site relies on the Global Safety and Support Network. We'll talk a little bit more about who they are, but essentially they are based in the UK. So they have a great network of private medical providers that is available to address a variety of medical needs in the London area. Most routine medical issues like colds or flus, you could be seen same day or next day for care at one of their network providers. For emergency, accident and emergency, so the equivalent of an ER, you would be relying on the NHS hospital systems. And while they are free for emergencies, most private care that we utilize through the network would go through our urgent and emergency care. That's because students on short-term programs, so less than a year, are not eligible for NHS coverage. And so it's easier, and really the only option for non-emergency care is to go through private means. And so our process through the Global Safety and Support Network is pretty seamless for most of those private care needs. If you are going to be on a program that's longer than, or that's a year, then you would have eligibility for NHS coverage. However, it's still often a lot quicker and easier to be seen by a private network in London, unless it is really that true emergency situation in which you would be seen at an A&E, which there typically is not a charge for A&E emergencies. But if there were to be, then you can contact the Global Safety and Support Network to help either facilitate payment or to be able to file for reimbursement. So as I mentioned, we also have a network of providers for, specialist care, for mental health coverage, for other counseling needs. I actually just met with one of the therapists in London that students frequently see, that works specifically with students studying abroad, and knows Northeastern and the American student experience really well. So we have a robust network in London. It's just not within a health center on campus. It's more out in the community. And so having that access to the hotline is really important, because that's going to be your point of access to care. So we have both a US or a UK based number. So those of you that will be getting a local SIM card, it may be easier for you to contact the UK number, but we do also have a US based number that you can call. And your residence life staff are very well versed in the hotline and in getting in touch with them, and can help you walk through that if need be. They do have an email address, but we do recommend that you call in the event of an emergency to get assistance as quickly as possible. When you call into the hotline, it is staffed by one of our partner vendors called Crisis 24, the Gardaworld company, which is the largest security provider in the world. They also have a medical assistance department, which was formerly known as the Collinson Group, but is now part of the Crisis 24 family. And so they are the ones answering the phone, and they are the ones triaging your call. The majority of calls into this hotline are medical in nature, so that's why they're answering the phone, to be able to provide you with the quickest amount of service. It is a dedicated Northeastern line if you call one of these numbers, so they'll know you're a Northeastern caller. They will notify us of your call, so my office will be notified of any calls into the hotline. This is to help coordinate assistance on the Northeastern side, but also to verify your eligibility for that urgent and emergency coverage. They have a number of a medical team on staff that can, they can triage issues. You can ask to speak to their medical team, and they have a nurse on call at all times. So if you're feeling sick and you don't know if you should go to the doctors, or if you just need to rest, or what medication that you should take, you can call in to speak to a nurse at any time, and they can provide guidance. If you do need a referral as a result to a local medical facility, they can help arrange that. So whether it be a general GP, a general practitioner appointment, or if you need a specialist, they can help arrange those type of things. They can also review medical record and make care recommendations. And then if there is ongoing care needs, they can help coordinate your care, or if for any reason you would need to return to your home to continue care, they can also help coordinate that. So most of the triage for medical needs on the Boston and Oakland campus would be run through those clinics on campus. But for those of you in London, this is often the resource that is utilized. And if you are in need of emergency assistance, please call local emergency services 911 or 999, depending on where you are, and also loop in your on-site staff. You'll be provided with the contact information for the on-call number for each site. So make sure that you loop them in if you are in an emergency situation so that they can help provide support to you. Just some notes about the insurance coverage for London that is provided. Again, essentially, it's a safety net for urgent emergency situations that arise while you are abroad that was unexpected, unplanned for, like say you get sick, you trip and fall, those type of things. And so it's not considered health insurance though, or travel insurance. It's essentially really just that safety net for you. It does not include routine care, lost glasses. Most dental care is not included. And so the list of exclusions and more information about it is located at globalsafety.northeastern.edu/insurance. And so while it may cover most things that arise that were unexpected, we tell you about all these exclusions now. So if there are any things that you need to plan for in advance, that you can purchase those proper insurances, or if, for example, you're someone that wears glasses, that you make sure you get an extra pair of glasses in case you lose it or anything like that in advance. So. When you are calling for assistance through the hotline, please make sure you identify yourself as a Northeastern student and the program type and location. Provide a callback number in case you are disconnected, and then basically tell the operator as in specific terms as possible what is already being done and what you need. So I'm feeling sick and I would like to speak to the nurse, or I tripped and fell and I think I broke my leg and I need to know where the nearest hospital is, or I tripped and fell and think I broke my leg and I'm going to this hospital. That can help them facilitate your care if you already know where you're going or what you're doing. So just be specific as possible, and then also let them know if your on-site staff has already been notified, or if you need assistance in doing so, they can reach out to my office and we can help facilitate that as well. Another resource that will be available to you throughout your Northeastern career is Find at Northeastern. It's a 24/7 mental health support line. It provides immediate support with a licensed mental health provider. It can also provide ongoing counseling sessions, and you are entitled to free unlimited counseling sessions. If you do need a specialist, so if you need additional care in addition to the counseling sessions, they can help you find a local provider that works with your insurance, but any referrals would not be included under the free unlimited counseling sessions. You can find more information about Find at Northeastern on UHCS's website. So on the University Health and Counseling Services website, there's a page dedicated to Find at Northeastern. They also offer free access to Headspace in Silver Cloud. I believe the Headspace access will begin at the beginning of the fall semester. So around September, you'll have access to that. But they are also great resources for you for your mental health and well-being. And those are not limited to your time on the Global Scholars or London Scholars programs. Those will continue throughout your Northeastern career. If you are calling from inside the US, there is a number there. If you are calling from international, there's a different number listed on the bottom here. Also, another reason why it's really important that you have international calling capabilities. So if you did want to utilize these resources, that you are able to do so. So there's a QR code. I think this can help you get to all of those different resources. UHCS also puts on some online workshops throughout the year with topics related to wellness and your health. So be sure to check out their website throughout the year to see if there's anything that is of interest for you to attend. UHCS, in conjunction with the Office of Prevention and Education at Northeastern, has put together a few mental health guides, which are great resources for you along with your family that discuss topics around mental health, mental well-being, how to speak with someone that may be going through mental health challenges, and it talks about different resources that may be available to you and some strategies. So great resources that they have put together both for yourselves and for your families, and we definitely recommend that you check both of those out prior to the start of your program. And a little bit about the Office of Prevention and Education at Northeastern. You'll hear more from them about them as you go through the pre-departure orientation process, but they are a great resource on campus that provides confidential resources as well as training to be able to support you through a variety of different situations. So they can offer alcohol and drug check-ins if you are in need of support. They also can do so for those that are not located on the Boston campus. They do remote services as well. They are a confidential resource in the Sexual Violence Resource Center. So you'll learn more about what that means going into the fall semester. But if you did ever want to discuss any matters with them, they are a confidential resource on campus that you can turn to. They also have resources for those who have been accused of causing harm or have caused harm to others as students. And additionally, one of the great resources that I think they have online is their online modules, which discusses bystander intervention and other really important topics as it relates to your college experience and what you may encounter and how to become more resilient and a better community member within the Northeastern community. So great resources for you to check out. You'll learn more about them as your Northeastern experience begins, but they can be found at northeastern.edu/open. So with that, I'm going to turn it over to Mary Barros in the Disability Resource Center to talk about accommodations.
Thank you, Alyssa. Good afternoon, everybody. As Alyssa said, my role is Senior Director for Learning Strategies and Student Success, and part of that portfolio is I oversee the Disability Resource Center. The good news is we have heard from a lot of you already who are enrolled in the Global Scholar Program, so that's really good news. Alyssa, next slide, please. So we want to introduce you. So if you did receive any type of accommodations in high school and you would like to receive similar accommodations while studying abroad, first visit the DRC website, and it's listed right up there. And you'll be introduced to our 3-step process. The process basically includes a student disclosure form. That's the student's voice, the student's opportunity to tell us what they think they'll need and why, what's worked in the past and what hasn't. We also do need documentation of a disability, and that comes in various forms. So if it's a learning disability, it's going to be some form of testing that was done at some point. Other psychiatric and chronic disabilities, we have clinical forms that are you can download off the website on that page and have the current treating clinicians complete them and return to us. Verification of receiving accommodation. So if the student had SAT or ACT accommodations, as well as an IEP plan, IEP or a 504 plan, we'd like verification of that. In the case of a private high school, what we usually ask for is on school letterhead, a letter stating what accommodations the student did receive. Next slide, please. Now, we ask that you begin with your first destination. But the good news is you will only have to submit your information once. The 3 locations, because they are Northeastern facilities, we are all on the same database. And actually, we're meeting monthly to make sure that we keep track of all the students that we have currently for the fall, and then those students and how we're going to exchange them for their second semester. So if you're beginning in London, the student support team includes Katie Crabtree, Femi Adeli, and then we have hired an additional person who will be starting next week. Please use that email that you see up there, disability@nulondon.ac.uk. You can communicate, submit information that way, submit documents, submit IEPs and 504 plans, and ask any questions that you may like. If you are beginning in Oakland, Courtney Gutierrez is your contact person, and use that email to communicate and submit documentation. And that's oaklandaccess@northeastern.edu. And of course, if you're beginning in Boston, you're going to submit everything to Kyle Droz is our director here at the Disability Resource Center, and everything can go to drc@northeastern.edu. Next slide, Alyssa. We suggest that you submit documentation ASAP. It gets busy. London does have deadlines. Their deadline is September 11th to submit documentation to receive any type of accommodation for midterms, which take place mid-October. So as you can see, the Students with Disabilities website is located there, and it's good to explore that. They go into very specific details about accommodations. And then again, the same email address if you have any questions. Boston and Oakland will use, if you are studying in Oakland, you'll be directed to the Boston DRC website. Excuse me. And also they have an oakland.northeastern.edu/student resources website as well. But for all of the forms that you'll need, you'll be directed to the DRC in Boston to use those forms. For Boston, submit all documentation if possible to our DRC documentation at northeastern.edu. Now, if you're submitted to the DRC at northeastern.edu, we will get it. So no worries. We in Boston and Oakland, we do not have hard deadlines. However, completion of the review and approval of accommodations are subject to volume. And I'm sure you can imagine that volume increases as we begin the semester, and as also we get closer to midterms and students think that maybe they should apply for accommodations, especially if they had a history of using exam accommodations. Alyssa, next slide, please. All 3 sites, we offer accommodations for exams, notes, and extensions. There will be some subtle differences. London's length of time for exams differs a little bit than Oakland or Boston. The requesting of extensions, London has a little bit different process for that, and they utilize a different person for whom you would be applying for the extensions. But the student support team is there to help you. So if there's any sort of question, they're the people to ask. Next slide, please. Okay, that brings us to the end of our webinar here. These 2 addresses, if you take note, take a picture, they're the very important email addresses that you will need. And then let us go to the questions and see if there's anything we can answer for you.
Yeah, Mary, before I get to some other questions, one of the themes is, if we did not receive accommodations in high school, can you speak a bit about if they can receive accommodations in college and what considerations are needed?
So that would depend on why you didn't receive them. If you did not receive them because you have never been tested or evaluated by a current treating clinician, you have to start with step 1. And you would want to do that while you're here. So if you're starting in London and you have this scenario, I would strongly suggest that you begin the process now. There are not a lot of resources for testing in London. There are clinicians, Alyssa did a fantastic job of telling you the types of clinicians that are available. But if you're testing for a learning disability, there are really not a lot of resources there to do that in the short period of time that you're in London. Remember, you're only there about 12 weeks. So we suggest that you did that. If you're coming to Boston or Oakland first, I can't speak to the outside resources of Oakland. I'm not sure what we're using as community partners. We do have community partners to which we can refer you for testing, or you can begin with clinicians if it's a psychiatric or chronic disability. But again, that's going to take time. So my strong suggestion is you try to get that information evaluated before you begin the semester.
Great. There's one question. I know I've seen a number of questions about those of you that are in London longer term and had to pay the fee for the visa. So one, that is a requirement of the UK government that you pay into that fee if you are going to be there long term. That does entitle you to NHS care. You would be eligible to register with the GP, and if that is something that you want to do, the London staff can help direct you on how to do that, and can help you get set up with that. And you can completely utilize NHS services if you want to. Again, that you are buying into that, you are entitled to that. You can sign up for that. What you may have heard about NHS care is that it has been overwhelmed over the last few years. And as a result, for those of you that are in country short term or even for a year, wait times for appointments for specialists can be longer than what you would expect maybe here in the US if you're from the US. And so typically our private resources through the Global Safety and Support Network can get you into care quicker, and can get you those resources that you need for specialists and whatnot, and in a more timely manner without as much red tape. But you are completely entitled to it. Like I said, it's a requirement that you pay into it as a condition of your visa. We don't have any control over that. It has to do with your length of time and the visa category and whatnot. But that is available to you. You will have access to if you are one of those students that would be staying longer term in London. So those of you that are only in London for one semester, you would not have access to an NHS GP, but those of you that are longer term there would be able to register with the GP and have a general practitioner at an NHS office if you would like to do so. So it's totally up to you in terms of if you are someone that will be there longer term getting set up with the GP. It certainly is good to have a general practitioner that can, especially if you are someone that might need some care management, but if you do need referrals to specialists, they can often take some time, and you may not have that time, depending on the circumstances. So just some notes there.
I have a good one here. Does disability apply to nut allergies? So everything is determined to be a disability when the limitation that it poses rises to the level of a disability. There are accommodations that we can provide for the effects of the allergy, should the allergy be deemed severe, moderate to severe, and potentially anaphylactic. Some of those accommodations are certain housing accommodations that can be made and certain adjustments to the dining options. Now in London, the students are in housing. There's no dining halls. They cook together as a community on their floors. They have small kitchens. So they pretty much can cook whatever it is that they can eat. In Boston, we do have dining facilities for first-year students. So we would, again, submitting the information as soon as possible gives us an opportunity to see not only what we would determine to be the accommodation, but the availability of the housing accommodation there. And same is true in Oakland. Let me see. Does the disability office coordinate any mental health counseling sessions, or is that all through the other mental health program? We certainly help students. The job of all three offices is to help students navigate any resources offered by the institution. So we can direct them to, University Health and Counseling in Boston, the Counseling Center in Oakland, and certainly work with the resources that Alyssa discussed for mental health services. So we can help the students get started. And then, of course, we ask them to share, if they can, information with us, if that's going to result in any form of an accommodation. Ooh, let's see.
Some general themes for documentation to carry with you in terms of a note from doctors. We typically recommend that you get a note that if you're on medication, that it describes that you are prescribed a specific medication for a diagnosed medical condition, outlining what that medical condition is, indicating the medication type, dosage, name, active ingredients, as the brands may differ between countries, and having that information on you, available to you. There are some questions about access to medical records. I would say assume that the UK physicians would not have access to US medical records unless you provide them to them. If you need some additional guidance on insurance, globalsafety.northeastern.edu/insurance has some additional information on there about some different options if you needed to purchase anything additionally. There are a couple questions about Silver Cloud and Headspace. They are different apps that you can utilize. I believe Headspace is more counseling focused, whereas Silver Cloud is more like exercises for your mental well-being kind of activities and different things that you can explore. But more information is on the northeastern.edu/UHCS website about those, and you can check those out.
I have a great question here. Oh, I'm sorry. Go ahead.
Yeah, go ahead.
All right, so DRC information was sent to the DRC in Boston. You haven't gotten a reply. Do you now need to forward all of that same info to London? No. Remember, one of the first few slides we talked about, we're all on the same database. So, we like you to start with your initial destination, but if you've submitted it to Boston and you're going to London, the London support team has access to the same database. So what I would suggest is you send a quick note to the London email, disability@nulondon.ac.uk, and just say to them, I've submitted information. Could you let me know, give me an update? But no, the one beauty of this is you do not have to submit more than once.
Questions about immunizations. I believe UHCS will be issuing a immunization checker form in the coming weeks. So I would stay tuned on that. I believe the requirements are on their website, northeastern.edu/UHCS. So you can start taking a look at what those may be to ensure if you need to get caught up on anything that you are able to do so. Let me see what else we've got here.
I have a question about a dietary restriction based on religion. Do you need to send documentation for that? No, it's not considered a disability, so our office would not be handling that. What I would suggest, and in London, you will be buying and cooking your own food, so I would imagine that you'd have the flexibility there. As far as Oakland and Boston, you can contact the dining services and find out what is available in the dining hall for your particular religion and work with them.
Something like the flu or sore throat is considered an urgent or emergency situation. Like I said, anything unexpected, anything unexpected that arises that was not a pre-existing condition, chronic condition of which you are already receiving care for, or is not part of the exclusions listed on the website, are typically covered. If you need specific resources, particularly for London, reach out to my travel plans at northeastern.edu and we can get you connected with those in advance. So if you're looking for a psychiatrist in order to be able to refill medication or things of that nature, reach out to us there so we can connect you.
Can I provide my own 504 and SAT accommodations? Absolutely. It does not have to come from the guidance counselor. So the letter that you were, with which you were provided that determined you had accommodations on either exams and the 504 plan, the most recent copy, you can submit those yourself.
And in regards to the dining hall in London, no, because you have kitchens. So you are able to cook your own food. And then there are near campus, there are a variety of different dining options. There is a cafe at the London campus if you wanted a snack or coffee between classes, but you are able to cook and eat your own food.
Same thing. If you had accommodations through an IEP, do you also have to submit accommodations received through the College Board for the SAT? I mean, the more you submit to us, the better history that we establish that the accommodations were needed. So.
Thank you, Mary and Alyssa. This was helpful. I know we do have some folks in the chat who might have joined us late. And so just so you know, we are going to be emailing all of the Global Scholar and London Scholar students this presentation and recording. So you can watch it back. You can get the specific links that were talked about and shared. We will do our best to maybe link the presentation as well, so you can have access to that. But that will be emailed out to all students and parents next week. So you'll please watch out for your email as you'll be able to get this specific information. But as Alyssa and Mary mentioned, please do check our websites. We update those sites frequently, just make sure that we have all this information. So we do ask that you Google specifically your question and maybe it'll come up via our website. I know there's lots of websites to manage, but in the interim, while you're waiting for this presentation, you'll probably be able to get some information via our websites until then. But with that, we are so excited that you spent some time with us today. Unless there's any other pressing questions from my colleagues, if you're seeing anything. We are excited to be able to, again, see some of you in Boston. You can ask us questions in person, but then also we will have other webinars this summer as you're moving through this process. And then as always, feel free to email our program for Global Scholars. It's globalscholars@northeastern.edu. And London Scholars, it's londonscholars@northeastern.edu. And we will, again, answer your questions, maybe filter our questions to some of our colleagues to be able to get your questions answered. But we look forward to, again, seeing you soon, talking with you soon, and have a great day. Happy Friday.
Bye-bye.